All right, we'll call this meeting to order. We have a quorum of the Committee on Access to Quality Health Care. Looking forward to just a single bill today. I appreciate everybody. I know our time has pulled many different directions, and we'll try to be good stewards of it. Thank you all for being here, Ledge Council. Chairman Hawkins, tell us about House Bill 234, if you can tell us your LC number, and we'll get started.
Thank you, Mr. Chairman. Thanks to the committee. I'm speaking today on LC 460375. Okay. As this committee is aware, last year we passed the HB 888, the Surprise Billing Consumer Protection Act. There was a section in there that addressed the ERISA plans. ERISA plans, especially in the insurance world, exempt anything that we do on a state level. I have been working with Legislative Counsel Vince Wiegand on this since we passed this bill, looking for an avenue to help the other 60 to 70% of Georgians that did not have the luxury of being protected by 888 due to the ERISA plans. Under the very great guidance of Vince Wiegand, you'll see line 23. At present, this state is not prohibited, however, from enacting legislation that would allow such plans to voluntarily agree to comply with the provisions of the Surprise Billing Consumer Protection Act. So in that light, we have drafted this bill, and Section 1 are definitions. The action part of this bill is found actually in Section 2 on line 47. It says self-funded healthcare plans may elect on an annual basis to participate and be bound by such act. So this is a choice by the employer to engage such plan. And it goes on to talk about the requirements, providing notice to the commissioner, and be bound by the Consumer Protection Act, Surprise Billing Act. Talks to dates on lines 56 and 57. It allows flexibility of January 1 or the planned date. And that's pretty much the bill, Mr. Chairman. I've got Greg Conley here from the Insurance Commissioner's Office that will speak to the bill also. I did meet with the Commissioner this spring and go over the legislation, and definitely want to work with their office to produce something that they can enforce. And so this is a result of that. Are there any questions?
Are there any questions from the committee? Now, this wouldn't involve any new alternative dispute. This is using the existing, what was already created in 888.
Exactly.
And would use the exact same system. DOI would oversee that.
Yes, sir. That's right. This bill, we're not opening up 888. This is a standalone bill, so we're not opening that bill back up.
All right.
That's correct.
No other questions. There's one other to present. Is that right?
Yeah. Greg Conley from the Insurance Commissioner's Office.
Thank you for being here.
Yeah, thank you, Mr. Chairman, committee members. I'm Greg Conley, the Executive Counsel for Commissioner King. I'm just going to offer some comments on this bill. This actually anticipates the new federal surprise billing legislation fairly well. The new federal law makes exceptions for states that already have surprise billing laws on the books, and in some sense it's going to defer to them, at least probably in calculating rates and maybe in using the arbitration process. We're still kind of waiting for several federal agencies to pass regulations, but the National Association of Insurance Commissioners is assuming that most states were going to have an active hand in taking ERISA plans through the surprise billing legislation passed by the federal government. So we think the department this is a great way to anticipate kind of the federal government going that way. And that would be the extent of my comments. If you have any questions, I'd be happy to answer them.
One quick question.
Sure.
I know this is separate, but if you've looked at the federal plan and, of course, compared it to the state, is there anything that addresses ground ambulances in either our bill, 888, or the federal bill?
The federal bill, no. The federal bill says
it did address air
on
ambulances in the federal bill, correct? Which
No.
we could never touch.
Yeah. But ground ambulances were left out of the federal bill. In fact, there's quite a few types of planes left out of the federal bill, and they expressly reserve those rights to the states. And so that kind of gives us a chance to expand more so if we wish.
Okay. Chairman Nix.
Yes, thank you. Did we intentionally leave the ERISA plans out, or was just this an oversight? I would have thought that most people get their insurance through some type of plan that's connected to ERISA. So was this just an oversight, or did somehow we just caught up to it?
So ERISA plans are regulated almost exclusively by the federal government, and we're barred from regulating them. And so ERISA plans were carved out of the original HB 888 because that would render the law unconstitutional. And so that's why ERISA was not in the original bill. But because of the new federal legislation, we, in fact, can let them voluntarily opt in.
They can't opt in. Okay, thank you.
All right. What's your number? Go ahead.
Well,
Yes, sir.
thank you.
Recognize.
Thanks, Chairman Hawkins, for bringing this bill. I've had constituents with these calls after we passed 888 that we thought we had it taken care of, and when we got to the bottom of it, it turned out to be an ERISA plan. So thank you for bringing this bill. I fully support it, and at this, if proper time, I'd like to make motion do pass.
Thank you. This is a, I think, a very important bill. We actually started working on this before the feds came up and passed their no surprise bill. And they have said with the no surprise bill that state payment standards are not preempted or otherwise displaced by the No Surprise Act. So what we set up in arbitration and the payment contracts and all will stand. We don't know for sure what they're going to do about the self-funded plans, but this bill, as you see, will be active and in law upon the signature of the governor. So we're going to try to get this in, have it on the book, so if they come back in January 22, the feds, they may well say, if you have an ERISA plan exemption in law, that will stand also. So that's why we've been sort of working on this quickly.
Any other, you can go ahead and make your motion.
Make a motion do pass.
All right, we have a motion. We have several seconds. Is there any further discussion on House Bill 234, LC 460375? See no other. If so, all in favor of passage, say aye. Aye. Any opposed, no. The bill passes on the rules. We'll do our paperwork shortly. Thank you all for being here. I want to be helpful with your time. We're adjourned.